gathered here today on Amiskwichi-Waskaikan, traditional Treaty 6 territory of the First Nations and the Métis Nation of Alberta Zone 4. We respectfully acknowledge and thank the diverse Indigenous peoples whose ancestors footsteps have marked this land for centuries, including the Cree, Nehia, Dene, Balto, Nakota, Blackfoot, as well as the Métis and Inuit. This land is and has been a welcoming place for all people who call it home. Edmonton is a place built for community, trade, friendship, and shared understanding. We recognize those Indigenous peoples who are still fighting for equality today, and we support them in the spirit of decolonization and reconciliation. We remain committed to honoring the struggle of our Indigenous siblings and joining with them to end injustice. Together, we call upon all of our collective honored traditions and ancestors to help us work together in the spirit of community and understanding today and onward. So why do we do treaty acknowledgements? We are all treaty people. Long ago, when the first settlers came to this land, they drafted treaties that Indigenous peoples signed with goodwill and in good faith. Those settlers and settlers up until today have not always honored those treaties. The treaties were meant to honor the traditional land and way of life of the Indigenous peoples, to ensure their rights and prosperity, and to build understanding and mutual cooperation. Today, we acknowledge treaty land as a way to recommit to honoring the spirit of those treaties and to recognize the continued rights of Indigenous peoples as the traditional stewards of this land. We recognize that many Indigenous peoples have been dispossessed of their land and traditional ways of life, and along with that, the prosperity that came along with them. We acknowledge the treaty to understand that we each have a role to play as treaty people in reconciliation and in righting historical wrongs that have taken place. We'd like to invite you to share your land acknowledgements in the chat box below if you're joining us from outside of Treaty 6 territory. Next, I'll tell you a little bit about us at the Center for Race and Culture. So since our establishment in 1993, the Center for Race and Culture, CFRAC, formerly known as the Northern Alberta Alliance on Race Relations, has brought together diverse people with an interest in promoting and supporting individual, collective, and systemic change to address discrimination and racism and to encourage intercultural understanding. Taking an intersectional approach, our expertise spans workplace development, community building, research, and education. If you're interested in learning more about us or signing up for future events, please visit our website at cfrac.com. So, this session is part of our initiative, Challenging Discrimination Through Community Conversations, and it's an ongoing series of online moderated roundtables and webinars with guest speakers from diverse communities, organizations, academia, and the general public. We seek to understand and address experiences of discrimination and exclusion in the Canadian context. By shining the spotlight on different forms of discrimination, we hope to encourage solidarity among groups and individuals interested in promoting social inclusion and equity. Our upcoming session, Understanding Policing and Criminal Enforcement in Canada, will take place on May 11th from 5 to 6 p.m. and we hope to see you there. Very quickly now, we're going to launch some anonymous polls on the screen, collecting demographic data. You don't have to answer, but it just helps us to understand our audience a little bit better. So that'll just take a minute.
Some with bullet holes in their back.
All right, thank you. I can see that people are answering the polls. I appreciate it. That really helps us out. So thank you very much. We'll just give it another 20 seconds or so because there's 6 questions to answer. It's nice that it's sunny out, even though there's still some snow outside, isn't it, if you're here in Edmonton today. All right, moving right along, I'm very excited to get to introduce you to our speakers and our moderator for this evening. So starting with Shamsi Degelioglu. So, Shamsi was born on December 26, 1932 in Istanbul, Turkey. She was 7 when the World War II broke up, and she remembers sirens, curfews, and eating with dim gas lights on. She completed high school with the Girls' Technical School diploma in sewing, arts, and crafts. She married and became a homemaker with a very busy volunteer life, working for boards of orphanages and raising funds for the education of low-income children. She was given a Lifetime Achievement Award after 32 years of community volunteer service. She followed her only daughter, who was living in Canada, after the loss of her husband. Semsi became a Canadian citizen in 2014. She joined the Mennonite Center for Newcomers to improve her English. She then found out about Changing Together, which has become her second home in Edmonton. She's learned about Canadian culture and created friendships there that she truly treasures. Semsi has friends from all over Russia, Bulgaria, Poland, Argentina, and the Middle East. She continues to be their oldest student and a part-time teacher of sewing. During the pandemic, Semsi started sewing and selling handbags to provide assistance to low-income girls in Turkey with education funds. This is her passion. She sewed close to 400 bags of all sizes in 2 years. Sofra, a Turkish restaurant in downtown Edmonton, bought 40 bags at once to help out when they heard about Semsi's mission. The story was featured on Global TV, and Semsi and her bags became famous. She's a grandmother of 3 and a great-grandmother of 2. Semsi walks and reads every day. She has done over 60 oil paintings of Canadian and Turkish landscapes. Semsi likes to stay connected with her Turkish and Canadian friends, and she continues to sew handbags. Next, I'd like to introduce you to Dr. Sherry Dalkey. Dr. Dalkey is an associate professor in the Faculty of Nursing at the University of Alberta. Her program of research aims to understand how to improve nursing practice with older people and focuses on 3 main themes: how nurses in interprofessional teams can enhance the care of older people, examining and improving nursing education related to older people, and looking at how nurses' perceptions of safety and harm and their context influences their practices with older people. For the past 3 years, much of her work has focused on improving how nurses are educated to work with older people. As a result, she has developed and tested 3 e-learning activities based on findings from her previous studies to enhance undergraduate nurses' education about older people. One of her current projects aims to diminish ageism through enhancing undergraduate nursing curriculum and participatory action strategies with older persons, gerontological experts, and national partner organizations. Another current project is examining how stigma influences how older people access information about cannabis and how to access it. Finally, I'd like to introduce you to our moderator for this evening, Laurie Sigurdsson. As the MLA for Edmonton River Review since 2015, Laurie Sigurdsson has worked diligently to make life more affordable for Albertans. She has previously served as minister in various roles, including advanced education, labor and immigration, and seniors and housing. Her advocacy for appropriate and affordable housing for all Albertans is part of why she was reelected in 2019. Before being elected, Laurie spent her life working for her community, developing a strong background in social services. She has been a social worker for over 30 years in a number of fields and mentors future social workers as an instruction at multiple Alberta post-secondary institutions and as a field placement supervisor. Laurie's committed to community service. She has served as the Vice President of Public Interest Alberta and has been involved with the Parkland Institute, the Greater Edmonton Alliance, the Mayor's Task Force for the Elimination of Poverty, and the Alberta College of Social Workers. Laurie has both a Master's and Bachelor of Social Work from the University of Calgary, as well as a Bachelor of Political Science from the University of Alberta. In 2017, she was awarded the John Hutton Memorial Award for Social Action and Policy to recognize her outstanding contributions in this field. She is currently serving in the official opposition as the Critics for Seniors in Housing and the Mental Health and Addictions Ministries. Laurie and her 3 sons are proud to call Edmonton home. This is our panel for this evening. Thank you for your attention. Please use the Q&A button to ask the panel questions, and I will hand the event off to Laurie and our wonderful speakers. Thank you.
Well, thank you so much, Serafina, for giving us sort of the overview and for the introductions. And just want to thank everyone for joining us tonight. It's wonderful to be with you. And of course, I'm very passionate about this issue, certainly as the previous minister under the NDP government with Rachel Notley as the premier. I was the Minister of Seniors and Housing for most of the mandate that we had. And certainly, I really had a great privilege and honor to be able to serve seniors in Alberta. And I know there are many things that could improve the situation for seniors. And I think this discussion tonight is really going to help a lot for us to sort of unpack a lot of what is in the way, what are the things that we can do differently, what are we exactly talking about here when we talk about ageism. And so of course that's where we're going to start. We're going to ask that question, and it's up on your screen. What is ageism? And I'm going to go to Sherry to start us off, and if she could give us her thoughts on what ageism is.
Thanks, Lori. Ageism is a socially constructed idea that is discrimination against someone because of their age. And there's discrimination against younger people and against older people. And I think certainly in the pandemic, it's brought to light some of the discrimination that older persons do experience. And how ageism is one of the last isms in our society, and that is socially acceptable. You just have to go to the greeting card aisle and you will see when you turn 7, it's wow, congratulations. And then you're over the hill when you're 40 or 30, and I think that portrays this perception that it's not a positive thing to be aging, and yet we all hope to live to a long age. And ageism can take the picture of something very overt, such as the greeting cards that I've just discussed, or it can be more subtle in what we would call benevolent ageism. And that may be something that we more often might even see in healthcare settings, where people may be over accommodating to somebody older in the guise of trying to take care of them. And what it can do, though, is erode their agency and their ability to self-determination.
Great. Well, thanks, Sherry. That's a term I didn't know, the benevolent ageism. And I see it used often, and it's something I'm very conscious of because I got feedback from the Seniors Advocate, which we don't have anymore. Unfortunately, that program has been cut by the UCP government. But even saying our seniors, like, taking possession, it's patronizing, and it's supposed to be kind, but it is sort of treating them as not adults. And so that made me think of that right away. So I appreciate you sharing that benevolent ageism. So Shamsi, I just want to invite you also to tell us about what you think ageism is.
Okay. I think ageism is how society think of old people and how old people think of themselves. Both could be wrong. In many ways, my first question is, when are you old? Ask my great-granddaughter, she probably thinks her parents are old, and her grandmother, who is my daughter, must be really old. Government thinks over 65 years is old. There is no official age of being old. I think it is a matter of mindset and how you live your life. Our needs and choices change from one person to person. For that reason, ageism is very risky, and there is not one way that applies to all people as they get old. The ageism I want to mention here is not about what others or society think of old people. For me, the important thing is what we, the old people, think about ourselves. We must be aware of our own vices. We can't affect other people's thoughts, but how we think of ourselves can make a big difference. The bigger responsibility and the opportunity lie with the person. I read somewhere a statement and I loved it. It goes like this: it is not the agents that brings inactivity, it is inactivity that brings aging. I believe we all can do much more. We try a bit harder, and it makes all the difference. I am saying, as individuals, we should be aware that we are not putting limits on what we can do.
Great. Well, thank you, Shamsi. And you've brought up an important point just about the relativity, like it's relative age, you know, like whether it's depends on who's looking. And as you use the example of your great granddaughter. So yeah, like, you know, someone who's 40 could look old to her. And that person to me is young. So it does depend a lot on the relativeness of it for sure. And yeah, thank you so much for your comments. Okay, we'll move on to the next question. And I'll go back to you, Sherry. And that's just about, why is ageism such an issue in our society?
I think it's an issue because we are averse to death. We're a death-denying society, and people who are older are likely closer to death. And as Semsi so articulately said, it's contrived because in our society at 65 you're a senior and you can retire, but age can be anytime. And certainly there's evidence in research that some of the most productive years of our lives are our 50s, 60s, and 70s. And hearing Semsi's bio, she's been productive well past that. So it is I think by not accepting aging in ourselves and by sort of othering people that we perceive as aged, it makes us somehow feel younger, and that could be what's happening. But there's also evidence to suggest that if we're doing that and we're portraying negative perceptions towards older people, we're actually doing that on our future selves. And we're internalizing ageism. And that's also something Semsi just so eloquently talked about, is that when we're internalizing it, then we are ourselves going to experience more negative effects about ageism. Ageism is one of the isms that will happen to all of us if we're lucky enough to live long enough. And so that's why I think it's so important that we bring attention to it, and we recognize that we need to disrupt negative perceptions about aging, and we need to applaud aging and in our society.
Yes, I totally agree with you. And, you know, I'm in my 60s and, you know, I have the biggest job I've ever had, you know, as an elected official, as the MLA for Edmonton Riverview. I mean, you know, in my 40s or 30s, you know, I just didn't feel like I could, that seemed out of the stratosphere for me. I never thought I could do anything like that. And so I feel like I'm an example too, and as is Shamsi, obviously, doing so many things for sure. So thanks so much, Sherry. Now we'll go back to Shamsi and just why is ageism such an issue in our society, do you think?
Okay. I can think of 3 reasons. One, there are many seniors all overall. That number is growing as people live longer years. 2, there are many areas that impact lives of old people, like healthcare, housing, quality of life, interacting with youth, social program, and others. Ageism affect the decisions made in those areas by families, by the government, and by the old people themselves. We need to think of people as a person and not in general. 3, the interests and attitudes of the old people are changing compared to old days. I used to play Super Mario with my grandchildren, and now I can play with my great-grandkids. So today's old people are much different than their parents and grandparents. What we know and think may not be correct. In general, people may think of old people as weak, forgetful, can't learn new things, can't travel, no longer beautiful, and probably can't take care of themselves. These are very negative thoughts and are wrong for many peoples. Yeah.
Yeah. Great. Thank you. Absolutely. And you brought up life expectancy. Shamsi, certainly we're living longer, healthier lives, and people are able to be, fully participating for a very long time. So so changing our view of that is important, just because there's a lot happening, and you're a good example of that, Shamsi.
I think you touched on another important point is I think sometimes because when people are 65, they may retire. People are working longer, but so we see that as not productive, and yet the productivity or the things that older people give to society are so abundant that we don't always recognize. That what we give to our families, that volunteerism, and the financial support. We pay taxes and sometimes support families. So I think that's sometimes under-recognized.
Right. So even if you're not in the workforce, you're still contributing significantly. Yeah, we don't measure things always only by having a job. Yeah.
Right.
Yeah. Good. Okay. Thank you, Sherry. So on to the next question. So how do identity factors affect the experiences of seniors? And I think what we're talking about here is whether you're a woman or a man, or perhaps you're part of the LGBTQ community, perhaps you're someone of, not the dominant culture, different race. Those are a few that come to my mind just to understand what we mean by identity factors. So how do identity factors affect the experiences of seniors? And I'll go back to you, Sherry, for this one.
Well, I think that certainly it can be very social exclusion, the more factors that you are. Certainly women, they can experience discrimination because of their gender, or if you're from another culture, English is your second language, you're a person of color. And in fact, if you look at factors that might socially exclude people, older persons may have more of those types of issues that might intersect to cause them to be socially excluded. But that it's also something that they can sometimes be supported in, or they can use to their advantage at other times. But certainly there are many different things, and also health, income. There's all kinds of factors that can influence older persons.
Right, for sure, Sherry. And, it can compound, as you say, sometimes a vulnerability.
Yes.
Okay, and we'll go back to Shamsi about this same question.
Intersectionality, I understand it, help identify agents' concern based on the individual's background, race, abilities, sex, and so on. I am an immigrant senior, and I will be 90 in 6 months. Challenges are different than someone who was born in Canada. I have difficulty with spoken English language. I am better when I write and read. Learning a second language at old age is hard, and sometimes it is sad for me that I cannot do it well. My granddaughter always have subtitles for me. When I watch TV, and sometimes she will find Turkish subtitles, which is very good. What people think of immigrant senior might be quite limited unless they are living with an immigrant grandfather or know somebody like that. Immigrant woman and immigrant man experience with ageism will also be different from the one another. Ageism can be understood better with intersectionality.
Right. Okay, Shamsi, and thanks for those good personal examples of some of the challenges as a person who is an immigrant to Canada, and you know, English isn't your first language, so that does create more challenges for sure. So to get support, sounds like your family's supporting you in that regard, so that's super. I have an example that I'd like to share just of, you know, how it could impact seniors' experience. And when I was the Minister of Seniors and Housing, of course, you know, making sure that there was affordable housing for seniors was important. And of course, when people go into congregate care, you know, so they're living, you know, and they have their own private rooms, but they eat together and they socialize together and they have all those activities. In Alberta, we do have this kind of unique program called the Lodge program, which is great, except one of the concerns, and we did some work on this when I was minister, is that like someone who maybe is part of the LGBTQ community and they feel hesitant to go into a lodge program because they think they have to go back in the closet, that may not be a safe space, that might not be a place where, you know, being gay is accepted. And certainly that was something that I heard from seniors, and, you know, they'd been living openly, but now they wanted to move into the congregate care, but they felt like, you know, I can't hide who I am. I can't hide my identity, but I don't, you know if I'll be accepted, and I don't want to be ashamed. I feel, you know, accept who I am. So that was something that I heard over and over again. So that's just a concrete example of, you know, how it does impact the experience of seniors. Okay, well, we'll go on to the next question then. What changes do we need to see in order to make our community more inclusive for seniors? And again, I'll go back to Sherry.
Well, I think we need to start by, and this is, you know, more than just our community, but our country worldwide, is we need to start to recognize that ageism exists. And because we're not going to ever make changes unless we actually acknowledge that it is. Of interest, earlier this year, I was looking at the anti-racism document put out by Health Canada, which is quite a good document, and it goes into anti-Black ageism, anti-Asian, all kinds of isms, Islamophobia, the whole thing, and ageism was not on the list. And I think that just speaks to how we don't even recognize that it occurs. So how can we really address it as a community unless we recognize that it is occurring and that every day seniors are experiencing it when they're purchasing goods and services, sometimes in their family relationships, and in healthcare, the way healthcare is structured, the perceptions that people have, the unconscious bias that we have. We've done a good job, I think, or a better job of identifying the discrimination that Indigenous people experience, that people of color experience. And we need to do a much better job about talking about people as we age and the discrimination that people experience. And what I'm trying to do is to look at what the World Health Organization suggests when it comes to trying to diminish ageism. And they suggest 3 different strategies. One is education. Another is intergenerational relationships. And the third one is policy. And so we need to start with some education. I noticed my grandson, when he was 5 years old, even though both his grandparents are very active and engaged in life, his perception about old people was that they're not as capable. And it comes from the storybooks that children read. It's that diverse. So education needs to occur at all levels. And certainly that's something that I'm trying to address with the nurses, because they will be student nurses, because when they graduate, they're going to be looking after older people in care. And it's important that they recognize that these are people and not try to be patronizing towards them. So education is very important at all levels. Second is intergenerational relationships. There is intergenerational wars. It's common for younger people to think, oh, the people who are drawing the pension now are using up all of our funds, which is totally inaccurate, because the Canada Pension Fund is whatever the employee contributed plus what their employer contributed, and it's being managed very well. And so that is not an example of the possibility, so it's an inaccurate, it's a belief, the tsunami of older people, that it polarizes people. It puts the young against the old, and we need to see each other as persons, and that the older persons have much to give to society, because often as we get older and we have less years ahead of us than we have behind us, which I'm also in that place, we think about how we can contribute. We think about how we can give back to the world. We want to leave the world in a better place. And so often it's older people who may be more concerned about the environment, or some of the things that are happening in our country that they see as not positive, or in our community or our province. And so having these conversations with older people, with younger people, the older people can help to mentor and support younger people, and the younger people can come with their fresh ideas and support older people. And together we can be, people that together are making a lot of positive strides for our community and for our society. Just because we're older doesn't mean we can't contribute. In fact, we have a wealth of experience and knowledge and wisdom that we can bring to bear with these issues. And then there's policy changes, and we need to think about what kind of policies we need to put into place to better support positive perceptions about people of all ages. And some of the things, I know that there's ageism aging friendly Edmonton. And I know that if we make things friendly, the environment friendly for older persons, we're making them friendly for children as well. So, you know, these initiatives can really support all of society, not just older people. And so I think really we need to take those tasks, but first of all, we have to educate people that it's occurring, and that we all have a part in trying to diminish it, because the more that we perpetuate ageism, we're sort of defeating our own selves. We're doing something negative about our future selves. And if that isn't enough of an initiative, I don't know what would be.
Yeah, we're interested in our own self-interest, aren't we? Yes, that we're all going to become seniors, hopefully. And so, yeah, we should be thinking about what are good policies for those. What is important with that. So thank you for all those insights. And I appreciated the reference to the World Health Organization too, and some of the key 3 things that you identified there. So Shamsi, I would like to ask you that same question. What changes do we need to see in order to make our community more inclusive for seniors? Is that, yeah, yes, that's the one. Go ahead.
Okay. As an immigrant senior, I have been a member of Changing Together Center for Immigrant Women for almost 15 years. The center has made a big difference in my life. I made friends with women from many different countries and different cultures. I learned English there. We went to museum, art gallery, and other places with the students. We learned about Canadian culture and history. We learned about each other's culture. It is a very friendly group, and it was easy to make friends. I enjoy serving, and I attending serving classes at Changing Together. I was even a teacher of serving. We used to go to exercise with my daughter and granddaughter. I took yoga lesson from another senior lady. The king of programs were very helpful to create inclusive city. Programs, yeah.
Okay.
Programs.
Great. Okay. So yeah, you were connected with an organization, a nonprofit that provided programs and helped you sort of get to know Canadian culture and understand, things like going to museums, the art gallery, exercise activities. So that, of course, all supported your well-being and absolutely being part of our Canadian culture here. So those are great examples. Thank you, Shamsi. I just want to say that, the example that I gave about someone moving into, say, a lodge program, congregate care, when they had some apprehensions, because, obviously there has been some prejudice, some bias against gay people, for example. And so one of the initiatives of the NDP government was that we had an education program. And so that's exactly what Sherry was talking about, like education is so important. So we had staff who would take this program to sort of have a more inclusive understanding, and so that they weren't discriminating, and that they're aware of all kinds of people who are now living together, so learning about that respect. So that was one initiative that we undertook when I was the minister, and there's tons more, but we'll go on to the next one. I won't take up too much time. So back to Sherry. So what community initiatives are available sort of to address ageism in our society?
Well, I'm sure I don't have a comprehensive understanding of what's available in Edmonton, but I do know that the Age-Friendly Edmonton group is making have lots of strategies. I've been in contact with them, and they're certainly trying to tackle ageism themselves in various webinars and whatnot, as well as trying to really promote physical things that are in our environment that would make it more accessible for people. And it's not even just people who are aging, people with disabilities, younger children, all of that. And then there's the SAGE, the Seniors Association of Greater Edmonton. I don't know if SIMCI's been involved with them, but they certainly have a lot of programming that they do to support seniors, people with other languages, and various other things. So there's lots of community initiatives. I know that I belong to the Alberta Gerontological Nurses Association, and I know that we were approached, as were other agencies, to give our perceptions about how to better support long-term care places in Alberta. And so I'm not that process to better support seniors that require care. Certainly the pandemic has brought to light that not all of these places are staffed in a manner that can support older persons to the optimum. And so working towards those strategies would certainly be helpful. I think there's much, much more that could be done. And I really welcome, first of all, we have to recognize that old people are not something that we should put away and forget about, but that they have a vital role in our community. And there's a book that I read about, it's actually 30 years old, but they were talking about some really positive ways that older persons could be used in communities, that, you know, because of their wisdom, maybe they could be part of helping to mediate conflicts. Maybe they could, you know, there's lots of roles that they could take as mentoring, and younger people. When you don't have to work for a wage necessarily, or you don't have a boss to be beholden to, it can open up the potential for speaking your mind or becoming part of advocacy groups. I think in the States of the raging grannies who take on issues, social justice issues. And I think there's a real place for that for older people that hasn't really been totally acknowledged to what could happen. So I think that some kind of community initiatives that support the wealth of knowledge that seniors have and their volunteerism and their desire to promote a better society could really be leveraged for the good of the entire society.
Great. Okay. Thank you, Sherry. Now we'll ask that same question to Shamsi. So go ahead, Shamsi.
Okay. Programs that promote independence, social instruction, staying close to the families, and young people are useful. Loneliness is the big problem when you are old. I am very lucky to live with my daughter and granddaughter. I do not feel lonely. Being around young people and always being connected with friends have my quality of life more than anything. I suggest also staying active physically and mentally and not being afraid to keep on learning. That's all.
Great. Thank you, Shamsi, very much. And maybe I'll just add a few things. And I think the question does talk about what community initiatives, but if we want to go even more macro, I'm going to say larger, oftentimes communities are supported by government policy. And so I'd like to talk a little bit about that. And there's a concept that I'm sure people are familiar with. It's called aging in community. And we know that seniors want to age in their communities. They want to stay in their own homes if possible, or, you know, close to those communities that they've lived in for many years. And so supporting people to do that, seniors to age in communities by having home care, you know, because sometimes they need home care, or perhaps one of the programs that we developed as the NDP government was the Seniors Home Adaptation and Repair Program. And so seniors could get a no interest, pretty much low interest loan if they had to do maybe some renovations on their house. Maybe those rugs became a hazard for them, like it was they had a walker and the rugs would make it dangerous for them, so they needed to have new flooring put in, or even just to maintain their homes, like with a new roof or something. Or maybe those stairs were just impossible. So getting some, getting a lift to be able to take them up the stairs, because we know that people who can age in their own homes and their own communities stay connected with, their neighbors, maybe the professionals that they might see, their doctors down the block, they're familiar with the parks in the area, or they, go shop at that particular grocery store, go to that drugstore. We know that that's exactly what seniors want. And so moving seniors far away from where they've lived for many years really is disheartening, and it keeps them separate from the things they're familiar with and they love. So of course, programs that support seniors to stay in their own homes is really important. And another thing, and Sherry did speak about this a bit, is just about like senior centers. And SAGE, of course, is the big one in Edmonton, but there's many others. There's the West End Seniors Association, there's the Southeast Edmonton Seniors Association. There's a whole bunch all over the city, and they're more like drop-in places where social activities, classes, they may have luncheons, they may have speakers come in, sort of similar to what you're doing here. They may do some of this virtually now because of COVID, but more and more people are physically getting together again. So there is a lot that can be done in terms of that. And of course, for these organizations to keep going, they need funding. These are nonprofits, they need support. So government choosing to support people. I mean, oftentimes, certainly I hear the UCP government say, yes, we want people to age in their communities. And certainly we said that too, because that's believed to be the best thing. However, sadly, a lot of the grants for those kind of nonprofits have been cut under the current government. In our government, we had about $2 million in that area. And I'm not saying that's enough. I think that it's a very important area for investment. And now we only have 900,000 in that area. So we know, and that was during COVID too, which makes it even more tragic. So we know that the more we support people to stay in their own homes, stay in their own communities, the better it is for their well-being, their sense of connection to the community. They're not isolated. Other programs like Meals on Wheels that can help people, or maybe they need help being able to prepare meals for themselves. And so having that service, Drive Happiness, that's another one, because transportation can be a really big issue for seniors, because sometimes the regular transit system, it's they have to walk too far for that, or it doesn't take them right to where they want to go. And so having that door-to-door service is so important. So I haven't been comprehensive, but there's a lot of things that can really make a society age friendly. And certainly we have some of these programs here in Edmonton, but oftentimes the capacity for them isn't sufficient, and we need to be supporting them more. And of course, the provincial government has the responsibility in that area. And it is also defers costs, because people who become more and more isolated may experience more mental health issues. It can impact their physical health, and then expensive programming like our health system, being in the hospital, those kind of things costs us more in the long run. So anyway, there's lots more to talk about in the terms of that, but certainly an expansion in that area would support seniors to be in their communities more connected and overcoming some of those issues of ageism. All right, so now is the time to ask questions and from the people who are attending. And I just want to look at them quickly here because I was talking. I think we have one from Linda. So maybe I'll just read it here. I'd like to ask, what kind of innovative programs have been put in place to support seniors during COVID? For example, at my workplace, we were introduced to a partnership with a senior home. Interested employees were able to connect with seniors through scheduled online meetups, get to know each other, and build a relationship. Isolation is a big concern for seniors, especially in the post-COVID world we live in. Oh, excellent. Well, that's so great that your employer did that, Linda. That's a good example. So I'll go to you, Sherry. What do you know about some innovative programs that had been put in place for seniors during COVID?
No, I don't. And that sounds like such a great idea that Linda mentioned. One of the seniors in our advisory group has made that suggestion as well, that the seniors in the organization, the residential area where he's involved, he said, they would be delighted to have, they've gotten technologically savvy, and they would be delighted to even be part of a classroom discussion and talking to a class about their experiences or having questions or developing relationships. And I think that's such a great idea, because that's one of the things that I'm thinking about in how to improve how student nurses are educated. My research has demonstrated that a lot of times some of the students are very, they're almost afraid of older people because maybe they haven't had grandparents around. They don't know how to talk to them. And then their first encounter with an older person is they're very sick and maybe not able to communicate as well. And so that sort of perpetuates a negative perception about aging and older people. So having opportunities like what Linda had suggested to have, to provide that intergenerational contact so that younger people can see the heterogeneity or how different older persons are, instead of having that perception that getting old is to be decrepit and have cognitive decline, that actually that's very, 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 very few people are in that. And I think SEMSI is a great example of being active and engaged and in her community and in her family. And those are the types of interactions that students and younger people need to have, so that they have a more positive perception about older persons. So I think that would be much, much better. Unfortunately, what I've seen is more that a lot of older people in these congregate living have been quite isolated again, to protect them against COVID.
Yes. Yeah. Right. Okay. Well, thanks, Sherry. There's a note. This is for Shemsi in the chat here, and I'm just going to read it out loud. It's from Raquel, Erica, and then I can't see the rest of it. I'm sorry. Hopefully I didn't slaughter that too much. It says, it's a pleasure to see Shemsi again and that she is well. And she says, I miss you. I think it's important not to separate activities for seniors and young people, to have associations and to carry out activities in which everyone can participate. Helps the integration and education of society. And we all learn from everyone and from the needs that each age has. So there's a nice little note for you, Shemsi.
Thank you very much.
Yeah, for sure. And now we're going to go to Joyce. And so Joyce is making a comment here about Canada should take a leaf out of the Netherlands with seniors care, in particular with family docs doing home visits for individuals who are unable or cannot easily leave their homes. So Sherry, I bet you might have something to say about that.
Well, I think that's great. I think we can certainly learn a lot from the Netherlands, and actually a lot of the Nordic countries, Norway and Sweden, have done a lot of research and a lot of positive things related to care for older people. I know that there are in Edmonton, in many of these agencies, we do have nurse practitioners that actually do make house calls and do their best to keep older persons well in their home, particularly during COVID, when we didn't want them anywhere near a hospital or a clinic where they could get COVID. I know that, but we could certainly learn more from other countries.
Yeah. Great. Thanks, Sherry. Yeah. And Renata has said the Alberta Council on Aging was part of an initiative on ageism. In the Netherlands, they focused on dignified elderly care, focusing on involving and empowering every citizen with a focus on their individual needs and preferences. So that is something that has been is also the Alberta Council on Aging obviously is here, and so that's some good work being done besides what Sherry did talk about. So let me see if there's anything else here. There is also a suggestion about for people who may be caring for someone, that to have support. The Caregivers of Alberta is a great resource. And so those resources will be shared with you in an email after this session. And there's some information from Jody Wood on intergenerational programs that attendees may want to check out. Oh, the Jerry Actors. Oh, I've seen them before, and they're amazing. So it's very fun. They're a group of older folks who, educate. They're doing education in quite a fun way by, presenting information through plays and things like that.
There was someone who also mentioned, and I forgot to mention it, that in the Netherlands and in other places as well, they have, they provide a place for maybe university students to live in nursing homes or residential care for a very cheap, like a cost-effective manner. And as part of their job, they are, taking out the trash or interacting with the older persons, doing little jobs with them. And it is a benefit for both. And it's a great way for them to learn more about the older population. So that's something that would be wonderful to, that would be something that a policy could be certainly supportive. That would help university students with the rising costs, and it would also benefit older persons. That's a great idea.
Yeah, for sure. And there's a pilot that I know when I was Minister of Seniors and Housing that we had with a housing management body that serves seniors in Calgary. So where younger students had cheaper rent, and then they did those, some different kinds of supports and socializing with the seniors who live there. So there is some existing in Alberta. And there's some more information in the chat about other further resources. So I see that we've hit 6 o'clock already. It kind of went very quickly, this hour we spent together. So I just want to thank both Sherry and Shamsi so much for sharing your knowledge, your lived experience on this issue. And certainly thank you to all of you who attended also and have shared your information in the chat and just wanted to learn more about this important issue in our society. And I think that can only be for the betterment. And certainly thank you for the center to host us here tonight. We're really grateful for this opportunity.
Thank you.
Thanks so much. Yes, it has been a great session connecting with you. Thanks for joining us. It was a pleasure to hear from you, to know more about the initiatives that are happening in our community and ways we can reach out more to our seniors in our community and value their experiences and their contributions to the community. And thanks everyone for sharing all the great resources. We'll make sure that we will include them in the follow-up email to all the participants. Please stay in touch. See you next time.